Hello again, welcome back. So, we talked about the societal trends around social media. We also spoke about some of the very basic things around social media, some of the basic platforms. I really hope that some of these sessions will just help demystify social media for you. I'm an Australian, so the way social media is used in Australia, in the UK, in the US, and in Canada would be very different. What are the universal indications for social media? Why should we, as surgeons and physicians, be using social media? And I can think of three very clear indications why you should be on social media and why patients will benefit or you will benefit from social media. Firstly, education. It is a two-way street. It's an active media where not only can I put educational materials online, I myself am educated by my engagement with fellow colleagues and also even learning about patient experiences through following patients and engaging with them online. The second thing is engagement. Engagement is a huge part of social media. Some of the networking that happens through Twitter and LinkedIn and Facebook is amazing. And so not only am I engaging patients and other colleagues, I'm also being engaged. I've had several speaking engagements organized. I've had several articles that I've written out of the request or the engagement of local magazines or local newspapers. And social media just really levels up the things that you do on a daily basis, but bringing it out into the open and therefore allowing people to engage with the materials that you put online. Thirdly, entertainment. Now, don't forget, it is social after all. At the end of the day, it's quite fun to be engaged with fellow like-minded people and to learn from our patients and to develop a really supportive network. What are the specific indications though? I see social media being used in multiple different ways: pre-consultation, after consultation, and also around the perioperative care. I'm a surgeon, so there's a lot of information that I need to deliver to my patients around the perioperative care. Pre-consult, you can imagine if a patient looks you up and finds you on the Facebook of your Facebook page or the internet blogging page, and then they come to see you. Every patient is anxious about seeing a doctor or a physician. Therefore, having a lot of information being put up online usually allays their anxiety. They know what to expect when they see you. And then the post-consult, now we are only allocated 10-15 minutes consultation time. There's a lot to be discussed in that short period of time, and we also know that a lot of patients forget many of the things that we tell them at the time of the consultation. Therefore, having online information, your 2-minute video on tonsillectomy will help the parents whose child is going to go through tonsillectomy. Your 500-word blog entry on thyroid cancer would be a great benefit to patients who have seen you but still want to go over some certain things after seeing you. Thirdly, around the perioperative care, obviously providing information about your surgery risks and benefits of surgery. All of that assists in helping patients through their health journey. I've mentioned this already. It catalyzes connections, not just between doctors, but also between patients. Publicizing publications, it's amazing the number of hits on your abstract if you start putting them up on your blog or Twitter or LinkedIn pages. It leverages the discussion. Just remember that the content is already there. You are doing the same things that you're doing repeatedly on a day-to-day basis and just putting it online, and that actually helps with reducing the amount of repetitive actions that you do on a daily basis. And as I mentioned earlier, extending care to the online space is quite important for patients who only see you for a mere 15 minutes, but being able to access a lot of information before seeing you, after seeing you, and after surgery is going to help in building patient rapport. What are the contraindications? Well, things like return of investment, financial benefits, advertising, marketing, driving the number of patients from online onto a real time. All these things are a whole different topic altogether, and these things are important in some cultural or country practices, where marketing your personal practice is important. That's a whole different topic altogether. It is strictly not a contraindication, but it is a different purpose of social media, and advertising on social media abides by a different ethical rule. Are all these things evidence-based? As you can see, there are thousands now, literally thousands of papers written around social media. We found, for example, these are just some examples, patients with chronic disease are reliant on social media for ongoing care, long-term support. And this is fantastic. Our patients are finding that social media network actually helps them. An interesting randomized controlled trial, where there were two groups of patients, one who had a YouTube video shown to them for preparation of a hip and knee replacement. Another one goes through the classic method of just face-to-face education, and it was found that those who watched the YouTube videos had a reduced level of anxiety at the time of procedure, on the day of surgery. This is another good article showing that when you put up your paper on your blog site, you get up to about 13 times or 10 times more views than just through the traditional journal circulation. So this would leverage the study that you've already done. It just brings it out into the open and allows more people to read that. And there are lots of other benefits among surgeons and among doctors as well. So we've talked about the indications, education, engagement, and entertainment. In the next session, we'll talk about some of the problems that may arise out of that, and this is often what causes a lot of fear among doctors and surgeons with regards to joining social media. See you in the next session.